Fracture of the radial head. This is the radial head and this is the neck. This part of the radial head remains inside the joint cavity of the elbow joint, and here are shown the articular markings of the radial head. Mason's classification of the radial head divides the radial fracture into the three types. In type 1, the fracture is partial articular and it is undisplaced. It remains at its place and it is called the type 1. In type 2, fracture is also partial articular and it is displaced. In type 1 there is no displacement and partial articular, and in type 2 there is displacement and partial articular fracture of the radial head. And in type 3 there is comminuted fracture, in which the bone breaks into the more than two fragments and it is complete articular fracture. Whole of the head of the radius inside the joint cavity broken into the multiple pieces, more than two fragments are present. Now treatment, if there is small and minimally displaced fragments are present, then they are treated non-operatively by temporary collars and cuffs, and if the fragments are large or major displacement are done, then block movements requires open reduction and internal fixation are done. And if the fixation is not possible, there is so much damage to the radial head and there is type 3 comminuted fracture, then excision of the radial head is done and radial head replacement is done.